The New York State Inebriate Asylum in Binghamton, New York, was the first hospital in the United States dedicated to the treatment of alcoholism as a disease rather than a moral failing. The facility came about during a period when the temperance movement voiced support for reducing the effects of alcohol abuse. The idea was conceived by Dr. J. Edward Turner with the concept that alcoholism required both clinical and moral treatment. Referred to as the Castle on the Hill, the imposing Gothic Revival building was situated on a sprawling 250-acre farm. It was designed by architect Isaac G. Perry based on the principles of the Kirkbride Plan, utilizing segregation of patients based on classification. Patients were separated into sections based on gender as well as the type and severity of their illness. Patients were housed in wings based on their classification, and administrative functions encompassed the center block of the facility. The building was designed with large windows for natural lighting, fresh air, and scenic views meant to restore mental and physical health. Building began on the facility in 1858. The first patient was admitted on February 22, 1864, while the building was still being constructed. It was completed in 1866. Interestingly, there were no newspaper articles in the days immediately before or after the first patients arrived regarding the opening of the facility. This is not necessarily surprising because although a new hospital opening may be big news, during the mid-1800s, drunkenness was considered a cause of most social and economic problems, and people tended to avoid speaking about inebriation in polite company. The Inebriate Asylum offered upscale activity facilities such as a gymnasium, bowling alley, billiards room, and large chapel. The grand design of the facility and the recreational perks led local Binghamton residents to view the facility as a plush resort for wealthy downstate alcoholics rather than a traditional hospital. Life in the Inebriate Asylum was regulated by the large bell, which was originally located in one of the 8 towers on top of the building. According to the facility rules adopted by the Board of Trustees on September 29, 1864, all lights in patient rooms must be extinguished at 10 o'clock p.m., and patients must retire to rest at the ringing of the bell at 1/4 before 10. Patients must arise at the ringing of the first bell in the morning. All patients must be in the ward of the asylum at the ringing of the evening bell. There were difficulties in management of the facility, with frequent disagreements and accusations of mismanagement between the founder, Dr. Turner, and the director, Dr. Day. There were major destructive fires that occurred in 1867 and 1870. The initial medical treatment for alcoholism struggled to show long-term success. Financial difficulties, fires, and political considerations led to the closure as an addiction facility in 1879, when the state legislature converted it into a psychiatric hospital called the Binghamton Asylum for the Chronic Insane. During the 1880s, a multi-building campus expansion took place. The name was changed again to Binghamton State Hospital in 1890 and then to Binghamton Psychiatric Center in 1974. In 1954, the 8 decorative towers on top of the building were removed due to safety concerns. The historic bell from the Inebriate Asylum was removed and is now on display in a pavilion in the yard near the building. Over a century, the facility continued to treat psychiatric patients. In the 1950s, it was home to about 3,400 patients receiving intensive therapy programs. By a decade later, it housed 2,500 patients, a decrease that was attributed to the effectiveness of the treatment programs. By the mid-1970s, the average length of hospitalization was less than 2 months, unlike the permanent incarceration from when the asylum was originally established. The facility was permanently closed in 1993 due to a dwindling population and structural safety concerns, with the building having fallen into disrepair. If you take the bridge crossing over the highway to Windy Hill Road, you find a sign for the cemetery for the Binghamton State Hospital. The cemetery property is closed to the public. Between 1890 and 1971, there were 4,009 patients buried in the cemetery. The New York State Inebriate Asylum was added to the National Register of Historic Places in 1996, considered nationally significant due to its role in the history of medicine. Today, the facility and ancillary buildings stand vacant and are deteriorating. Preservation efforts and potential stewardship and rehabilitation plans have stalled due to financial limitations. If you enjoyed this video, please like and subscribe to learn more about awesome upstate New York.